Good morning. Today we'll be talking about the topic Your Smile, Your Health, the link between oral hygiene and overall wellness. Good morning, Dr. Adeniyi, Dr. Temitayo, and Dr. Akinbami. It's a pleasure to have all three of you here on the program.
Good morning.
Good
How are you
morning.
doing
Thank you for
today?
having us.
Yeah, good morning. It's a pleasure to have you all here. So I must tell
Yes.
you that people are not buying it. They're not buying what you've been selling. People are saying, why do they say oral hygiene and overall wellness? That why is oral hygiene important for overall health? They don't believe you, dentists. They think you just do anything to get them to brush their teeth and coming for scaling and polishing. So the
Oh,
issue for
really?
me is, yes, they're not buying it. So can you explain how poor oral health actually affects the rest of the body?
I mean, you said it. You said it yourself. Poor oral health. And that means when you have poor oral hygiene, when you can't eat, it definitely affects the rest of your body. If I put it that way. I mean, what do you think, Doctor Adeni?
Absolutely. Your mouth is like the mirror and the gateway to your body. Everything that goes into your body,
Exactly.
usually in normal, when the individual is healthy, you're passing everything through your mouth, and then major
Exactly.
nerves, major blood vessels that link the mouth to other parts of the body. Inflammation that occurs in the mouth is occurring in other parts of the body that you cannot
Exactly.
see. And so if your oral health is in a bad position, trust me, everywhere else in your body, we're seeing something. And for every systemic condition, almost every systemic
Yes.
condition has an oral manifestation, from HIV
Exactly.
to diabetes to
Exactly.
rheumatoid arthritis. We're seeing a big connection between people who have Alzheimer's now and their oral health. We're seeing that the inability to get your scaling and polishing done regularly affects how healthy you are in your old age, how your brain functions. And so you cannot disregard this. In pregnant women, we're seeing low preterm birth weights associated with
Yes.
oral conditions. We're seeing that
Exactly.
every woman who has early morning sickness has an
Mhm.
oral manifestation that is affecting pregnancy. And so, no, you cannot disregard oral health. And we're not just selling anything, we're out there for you. We're preaching because in the end, you would be saving you a lot. And
In-
just to add to that, aside from the fact that the mouth is like the gateway to every other part of the body, people need to start seeing the mouth like a guardian. You don't want a condition where you have weeds outgrowing what you exactly want. So when you have that mindset, you will take care of your mouth like you take care of your body. And I've seen that Africans generally just neglect the fact that, oh, my oral health. They go to the physicians for checks. You hear I'm going for my annual check, but they neglect going to the dentist. And then eventually you'll be hearing things like, I don't understand. When I brush, my gums bleed. Why won't it bleed when you don't even take care of it at all? So yes, we need to know that what happens in the mouth, definitely just like a mirror, a window, like Dr. Funmi said, is what is happening in the body.
oh, well, I think and you're starting to convince me and my listeners. So tell us a bit more. There's some misconceptions about oral hygiene. Can you tell us perhaps one or two of them and explain them away?
There is one I have heard is if I brush my teeth harder, it will be whiter. It's a lie. Yeah, and the analogy I like to give is if you eat, maybe let's say eba, I mean we're Nigerians, so if you eat eba and maybe you forgot to wash your plates, and then do you just go and use iron sponge to be scrubbing? You're going to spoil the plates, especially if it's ceramic. You want to soak it first, allow it to dissolve, then clean gently. That is how we should view our teeth. You're not going there to scrub gutter or anything. So we need to take care of our teeth like that. It's like egg. So gentle circular motions. And this idea of I want my teeth to be whiter. I've told people a lot of times it's not the how white it is that is how thin your mouth is. It's not a factor. Everybody has different genetic makeup. So because someone is darker and their teeth appear whiter does not mean you that you're light. Your teeth appearing yellow means that no, it doesn't even follow. So that is one I've heard of, and it needs to be debunked. It's not how hard you brush your teeth that makes it cleaner or whiter. So that's one.
So for me, yeah, people say once I use mouthwash, I don't need to brush at night. You
Mm.
know,
No.
no, it doesn't work that way. Brushing and using of mouthwash are two separate things. So for healthy gums and teeth, you have to brush before going to bed. Mouthwash is just an additive, just an add-on. But brushing before going to bed is very important. You can't substitute brushing with the use of mouthwash. So please don't do that.
For me, it would be
That's it.
my toothbrush is enough. I'm brushing regularly. That's enough. For me, that is not enough. You need to visit a dentist every 6 months to supplement what it is that your toothbrush does. You should be changing your toothbrush every 3 months, and then you're flossing daily, and then you're visiting your dentist every 6 months because your toothbrush is not enough.
Now,
Yeah.
this whole issue of flossing. Sorry, I need to just jump in there. Most people don't even know what you're talking about.
Okay,
You
so
know
the floss
that.
is well, I think there's higher public awareness of these things now.
Yes.
We're talking about it almost every day on social media. We're bringing out threads showing them when they visit the clinic. So I think there's increased awareness. I went to a restaurant recently and I saw dental floss on the tables instead of toothpicks. So we're
Wow.
making progress. Yes, we're making
But I
progress.
think that how to use it is still a problem because the other day I entered Danfo and the conductor was with dental floss. He just finished eating something and he was using the tip. So why not just use toothpick if you want to be using it? I had to tell him that Oga he said no, no, it's this one that will remove it. So I think how to even use it is still a factor. Yes, while they know that toothpicks are not encouraged, they need to know why you need to use a dental floss and what part of the dental floss should be used. I think if people know this much more, they would, be forthcoming. But having it in restaurants, I think it's still not okay because
But it's a
I think it's
start.
just not okay.
I've
It's a
been to
start.
rest.
I agree. I agree with that. Yeah.
It's a start. So we just need to push on there. Any other myths we want to talk about now? Or should we move on to the connection?
That
Because,
would
Um,
you
be
know,
sugar.
sugar. Okay, please.
Sugar causing cavities, only sugar causing cavities. And I've heard this over and over. I've stopped taking soft drink because I don't want to have cavities. We need to understand that is an interplay of different factors that cause cavities. It's not just one thing that causes cavities. So where you have, and I tell people that it's just like you have your house, after work you go home, the bacteria in the mouth, that's where they live. What you don't want is to create an environment where they would thrive and then cause issues for you. So if you take sugary food and you have poor oral hygiene, people forget that if you don't do the usual oral health measures, your whole don't taking sugar is not a factor. There is time, there is the food you eat, and there is the measures you take in cleaning your teeth. So imagine someone that doesn't follow through with all of this and just eat sugar and then rinses out, and that's this. You don't brush, you substitute brushing for mouth rinses. Over time, those bacteria will act on that sugary food and then they'll release an acid that's not going to
Mm.
start making enamel weak. And that is how the cavity forms. Just like, when we eat food, digestion happens, and then you go to the restroom. That is just it. What they are passing out is an acid. So it's not enough to say, oh, you're stopping soft drink for a while. You need to understand that it's an interplay of different factors. The time, the food you eat. So change your food and also make sure that you are doing the right things. Brush twice daily, floss at least once daily. These are measures to put in place. So I think I will have that.
Thank you so much. So we've talked about heart disease, and there's a whole issue or discussion around gum disease, periodontitis, increasing the risk of heart disease. So how does that happen?
I was going to say that, when inflammation like this happens, it's when there's inflammation and like Dr. Funmi already said in the beginning, there are blood vessels, they're interconnected. There is no part of the body that is in isolation. So when there is inflammation, obviously there's an active process going on. And when this is links to the blood vessels. It can add to the plaque in quotes that is in blood vessels, lining blood vessels. And there's something called atherosclerosis. And this is one of the things I feel like causes stroke. So it makes people at risk of developing stroke. So that is one way I can explain that.
Okay. Because I mean, we had a lot of discussion earlier. I mean, you talked about the link between oral health and premature birth. I mean, oral health and diabetes, oral health and Alzheimer's. I mean, these are just really important things that if we could understand a bit more about how it happens, particularly the link between oral health and diabetes. There's a lot of people out there with diabetes, and they want to know, does the bad oral health worsen my diabetes? Does it make it, more of a problem for me? What's that link between oral health and diabetes, and what do people with diabetes need to know to take an active or proactive stance about it?
When someone is diabetic, you have oral manifestations. So it shows that it's a sign that the body is going through some systemic diseases. So, for example, the patient comes in, then you ask questions about their health. Yeah, there are sometimes that we detect diabetes when the patient comes into the dental clinic. That's when the patient is aware that they have diabetes. But by the time we look into their mouth, we ask them questions. We ask, how many teeth have you lost? They tell you maybe 2, 3, 4. We're already worried. Then you now ask them, how did you lose these teeth? And some might say, oh, they just fell off. So that is a huge red flag. For the tooth or the teeth to just fall off, that's a huge red flag, meaning that the diabetic condition has affected the periodontium, that's the periodontal, the supporting structure of the teeth. So, and this allows the teeth to just fall off on their own. So when they come in like that, we tell them, go have your blood sugar done, test done, and then they now even discover that, oh, I am diabetic. Then we have to send them for appropriate treatment. So the oral manifestation of diabetes is what we as dentists usually pick up, and then we send them
Help
for
with the
appropriate.
diagnosis. Okay, help them with the diagnosis.
Yes.
No,
Can
I
I
think
add,
this,
with
yes,
diabetes
please.
also, because there's increased levels of blood sugar, there's usually poor healing in those cases. And so sometimes you have cases where, oh, we've treated and it seems like this thing is not healing, there's no resolution to it. And then we realize that there's diabetes. There's also the case of dry mouth. Sometimes it alters how much of salivary flow the patient has. And once there's dry mouth, it is the recipe for disaster in the mouth, because we need that moist, wet environment in the mouth to keep everything flowing, to keep the teeth being cleaned, to keep healing happening. And so when that happens, usually where the patient is already in a lot of trouble then. So we need to keep blood sugar controlled to prevent oral manifestations from escalating out of proportion many times.
Okay, thank you very much. Now, talking about signs of poor oral health and what to watch out for, can you tell us what are the early warning signs of gum disease and other oral health issues?
Bleeding gums. That's the simple and straightforward one. Once you're brushing and you spit out and you see blood in your saliva, you should just go see a dentist, have your cleaning done. And then sometimes it could just be that you're not brushing well, you're not brushing at night before going to bed. So you could just pick that up. And then also go for your cleaning, regular check. Yeah, so that's one.
Any other ones?
There will be a case of swelling, like you said, bleeding gum, maybe when it's swollen also, and also persistent bad breath. When you notice that even after maybe you cleaned and you still feel like maybe your mouth is smelling or something, you need to go visit the dentist. It could be like in line with the question that was asked earlier, that someone has tongue coating. So you brush, but you don't brush the tongue very well, and then there is tongue coating. It can also be a factor.
So talking about bad breath, let's move straight on to bad breath because that's a big issue. some people have really bad breath, and it's often very embarrassing, particularly if your boss has bad breath. You can't tell him about it or her. It's embarrassing. You don't know how to handle that matter, you know? But how does bad breath really indicate deeper health concerns? Does it or does it not?
It would depend, because it's not every time that bad breath is linked to oral issues. There are times when it's also systemic, because you have some systemic diseases that have a characteristic kind of breath that comes. So kidney disease, maybe when someone has liver disease, there's a kind of breath that comes with it. But the one that is related to oral health, it could be that aside from tongue coating, it could be, I've heard of people that have tonsillitis, and then they tell you that the stones, they smell. Other times it could be upper respiratory tract infection. So it's not entirely, and other times for patients that have orthodontic braces in their mouth, and braces or anything in their mouth, appliances, and they don't take care of their mouth, food trapping and all of that can also result in oral
Bad
halitosis.
breath,
Yes,
yes.
bad breath. So you need to visit your dentist to be able to know what the root cause is and then attack the root cause.
Okay. Thank you. How about ulcers? Frequent mouth ulcers or sores? How does one, how is that a reflection of poor systemic health or your overall wellness?
Sometimes oral thrushes arise in the case of diabetes, as we mentioned before. There's high fungal infection rates, and then it begins to manifest in the mouth as oral thrushes, oral ulcers. Sometimes it's an autoimmune condition where we have just oral manifestations of thrushes, of ulcers, and it's just because the patient is under a lot of stress. Sometimes it's a reaction to products, because I know when I was in the university, there was a high rate of clients reacting to a particular oral product that was on the market, and the Nigerian Dental Association had to take them to court, the people who were producing those products. And so there's a wide range of different reasons why there could be ulcers, but many times when you visit a dentist, we can nip it in the bud, we can find a solution, and it can be reversed many times. Sometimes with HIV also, there's a lot of oral manifestations of ulcers in those cases also.
So I think for me, ulcers is clearly something that you shouldn't just hang around with. You need to take it to the doctor, and I rather take it to the dentist. That's really important, because obviously, from what you've described, there's a wide range of things that could cause it. And how about dry mouth? Dry mouth, what does it indicate, and how does it affect oral and overall health?
So dry mouth is definitely a systemic problem. It means that the salivary glands are affected. Yeah, and one needs to definitely see a dentist. Now, what happens when the mouth is dry? The person could have mouth sores, mouth ulcers. It means that there'll be a lot of friction between all the moving parts in the mouth. And also, person is at risk of having uh, gum disease, having holes in the teeth. The acidic level in the mouth just rises. So there's a lot of pH imbalance, and a lot could be happening. But it's very important that once one notices that the saliva, the mouth is dry often,
Yeah.
just go see a dentist, and you could just need to drink water, or just chew more. But it's best to just see a dentist report and then monitor and then move from there.
Okay, thank you.
Also, in cases where there's dry mouth due to medications, because a lot of people are hypertensive. Their hypertensive drugs have the side effects of dry mouth. Diabetic drugs, people on carbamazepine, and children with special needs that have many drugs that cause dry mouth as a side effect. It's important that you see a dentist, because we have saliva replacement therapy sometimes beyond just sipping on water and chewing gums. There are other treatments that we can to reverse these conditions.
Now, unfortunately, time has really rushed on, and so we don't have much time left. So we just have a few minutes. So I'd like each one of you to please just address in your last words to our listeners, good oral hygiene practices for a healthier life. What are the most essential habits for maintaining good oral health? Can we start with you, Dr. Adeniyi?
Visiting a dentist every 6 months, because there's a lot that we can nip in the bud when we see you. I say that you never have to extract a tooth due to cavities or any periodontal condition. If you're visiting your dentist every 6 months, it takes a long time for the enamel to break down and then for it to reach into the pulp eventually. So if you're visiting your dentist every 6 months, we can reverse a lot. I've seen older women who religiously see a dentist every 6 months. They live their full lives with their full complement of teeth. Nothing is missing because of just that one singular practice of visiting a dentist.
Thank you. So, Dr. Akinbami, what's your own advice for good oral hygiene practices?
Brush twice a day. Brush especially before going to bed. So don't just say I brush twice a day. Then after brushing, you then go to eat something, then go to bed.
Chocolate.
So yeah, exactly. So let me say, brush before going to bed. Let brushing of your teeth be the last thing you do before going to bed.
And Dr. Temitayo,
that will be
one for the road.
To floss. If you cannot floss after every meal, please floss at least once a day. Just do it. Just buy floss. It's at least 500 naira. Just buy floss and make sure that you floss at least once a day. If you can do it after every meal, it's okay. So that would be my own advice.
Okay, so thank you very much. It's really been a pleasure talking to all three of you. Thank you so much for sharing on the program.
Thank you for watching. Please like, share and subscribe for new video updates.